Coming up, we'll be on location at Millennium Family Practice in Columbia, Maryland, discussing the benefits of primary care medicine and how they can help improve your overall health and quality of life with one of this region's top doctors, Dr. Njide Udochi. Dr. Udochi is board certified and a fellow of the prestigious American Academy of Family Physicians. She completed her residency in family practice from George Washington University Medical Center. Dr. Udochi is widely recognized as one of this area's top doctors. Welcome, Dr. Udochi. It's a pleasure having you on our program.
Thank you.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have some patients that are going to be joining us a bit later. But I wanted to begin, if I may, Doctor, by having you tell us what primary care medicine is for those of us who may not know.
Well, primary care medicine involves preventive care, where the physician is actually the gatekeeper for the rest of medicine. And primary care physicians provide both education as well as health care to patients who come to access the medical system. We focus a lot on preventive health care. We want to encourage patients to come in and get checked, and also offer them some counsel and advice on how to make their health and make their health better and improve their health.
Primary care doctor is someone like yourself, who we should all come to on a regular basis to make sure we're healthy, we're staying healthy, and if for any reason we have a health problem, obviously either yourself or other primary care doctors can take care of it, or you would refer us to a specialist.
That's correct. Primary care doctors are the first port of call, as you may say, for patients. We are here to help patients, to help them recognize, or advise them on all the correct things to do and how to keep themselves healthy, and so as to prevent any other illnesses that may creep up. There are certain recommendations that have come up from the U.S. Preventive Task Force on healthcare that we follow, and we try and monitor with our patients. We are also the ones who provide continuing care for chronic medical problems such as diabetes, high blood pressure, and asthma. And we're here to work with the patients. It's a collaborative effort. The way that I work with my patients, we work together to make sure that we can access their health and make them understand the best way to manage their health and keep them healthy.
Yes, that's so important, doctor. It's a preventive approach, of course.
Exactly.
To keep us healthy.
Exactly.
And those are some major benefits as well that you just covered. Are there any other benefits that you could mention as well regarding coming to a primary care physician?
Although we do focus a lot on preventive health care, when you come to see the doctor, we're able to recognize and diagnose acute problems also. As a family physician, I'm trained to be able to treat all ages of patients. So I see patients who are kids and all the way to geriatric patients. And primary care doctors can diagnose and treat acute problems. So for instance, people are sick and they have sinusitis or ear infections, any chronic medical problem, they can come to the doctor and we can diagnose that medical problem, provide appropriate treatment, and also provide them with a referral. If somebody's having chest pain, and they come to their primary care doctor, we're trained to be able to recognize whether it's actually a coronary event or not, and also refer them to the appropriate specialist. If we think it's a cardiac event, we will send them to see a cardiologist. If it's something that we think it's urgent, we send them to the emergency room. And if it turns out that it's something that it's more gastrointestinal, we can refer them to the gastroenterologist.
That's certainly a thorough, comprehensive service plan that you all offer here, as far as either helping them yourselves based on what is afflicting oneself, or referring them to the right specialist.
Exactly.
Working as a team, right,
yes.
Doctor?
Yes.
And what are some of the typical patients that you see here at your practice?
I see a lot of patients who have multiple medical problems, including asthma is very common. We see patients who have heart disease, high blood pressure, and diabetes, very, very common. We also manage and treat patients who have depression and other psychiatric illnesses, such as anxiety disorder, as well as major depression.
Are there any other services that you offer beyond what you've covered so far?
Yes, there are other services that I also offer in my office. I'm also an HIV specialist. I'm board certified in HIV medicine, so I do have about 100 HIV positive patients who come to my practice, and I provide the primary care as well as the specialty treatment in terms of the management of their HIV. We want to blend it now with their total health care and provide them with the appropriate treatment for their HIV as well as manage their other medical problems. As you may well know now, people aren't really dying from HIV, and they're living longer and they're able to have very good quality of life. So we provide those services here. We also provide services to manage patients who are addicted to opioids. It's a big problem now in Maryland, and specifically in this area. So we see a lot of people who have prescription drug dependence, and we provide treatment for patients who need Suboxone. Suboxone is the medication that we use to help manage patients who are addicted to opioids.
Oh my goodness,
Yeah.
very interesting. You
Yeah.
offer such a wide range of services and
yeah.
helping so many different types of people out
Yes,
there.
we also do weight loss.
Oh.
There are many new medications that have come into the market now to help manage weight loss, but it is important that patients seek the advice of their physician so that they're able to look at their total health, and then we provide them with the right guidance in terms of not just the medication, but in terms of nutrition, diet, and the lifestyle changes that are needed to sustain the patient and sustain the weight loss so that the patient has a better quality of life and to also help improve their overall health care.
Yes, indeed. So we don't just lose the weight short term, we keep it off.
We want the patients to keep off the weight and also to be healthier.
And do you accept insurance?
Yes, we accept a wide variety of insurance. We accept all the commercial carriers, and as well as Medicare and some Medicaid managed care.
That's certainly good to know, Dr. Udochi. And how long have you been practicing here in the Columbia, Maryland area?
As a matter of fact, I've been a physician since 1988, but I've been in private practice since 2004. And I've been in this area. My office used to be in Ellicott City, and we moved to this location approximately 4 years ago. Oh. And so I've been in the Columbia, Ellicott City area for approximately 11 years.
Well, you certainly helped lots and lots of folks with all different types of situations. We're now going to meet some patients of Dr. Udochi. Welcome, Diane. It's a pleasure having you on our program.
Thank you. I appreciate being here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Diane, I'd like to begin, if I may, by asking you if you can please tell us what brought you here to Dr. Udochi.
Well, I had sustained a injury to my left eye, and a friend of mine had referred me to her office because there were a lot of doctors that were not taking patients, and she basically saved my sight. She diagnosed me immediately with a detached retina and sent me to Johns Hopkins that day to have surgery. And so I'm grateful. I was so scared. I worked with people with disabilities my whole life, and I was terrified of losing my sight. Dr. Udochi is extremely comforting and nurturing, and she's a very touchy-feely person, and I've never had a doctor that has hugged me before, and she's that way with all of her patients. Very close and gets to know you in mind, body, and spirit. She treats you.
Oh, that's certainly very good to know, Diane, and obviously she looks at each of her patients and treats them like family.
Yes.
And you don't see that too often
Yes.
these days in medicine.
And when she refers you to someone, often she's already had her family member go to that specialist, and that's even more comforting to know that you're being treated the same way she would treat her own family.
And before we let you go, Diane, for all the folks out there watching, what would you tell them about your experience with the staff here as well?
Oh, the staff are sort of an extension of Dr. Udochi. They're extremely nurturing. They know you, know your family. Really take the time to get to know you as a person and not just a patient. And and it's always been that way. I've been coming here since 2006, and I just can't say enough. When I'm out in public or in a store, I often get engaged in conversations where people don't have a primary care doctor, and I have extra business cards in my wallet, and I end up referring them to Dr. Udochi, because she's like the Hope Diamond. She's the creme de la creme when it comes to doctors. And I've always said to her, there's only one way that I would end up, or three ways that I would end up not having her as my doctor anymore. Either I kick the bucket, she does, or she gets her own talk show.
Well,
and so I plan on sticking with her she's a little younger than I am, but I plan on staying with her because she's done so much, and she gives so much of herself to every patient, and it's worth the time if you have to wait a little bit, which isn't usually the case, but it's absolutely, you leave here feeling better than when you came in.
And I think that says it all, Diane. And she takes the fear out of coming to a doctor, and she treats everyone like family. And I think what you just said right there says it all about her and her staff here. And
yes.
On that note, I'd like to thank you, Diane, for joining us, sharing some of your experiences, and being a guest on our program.
Well, thank you. I appreciate having the chance to support my doctor and give her rave reviews, because she's just a phenomenal woman all the way around.
Welcome, Sinead. It's wonderful having you on as well.
Thank you for having me.
I wanted to ask you, Sinead, if you can please tell us what problem or problems were you experiencing that brought you to Dr. Udochi?
What brought me to Dr. Udochi's office was a diagnosis that I had called Bell's palsy. I was referred to her actually by my daughter, who was a patient of hers. I came in, and Dr. Udochi happened to be standing in the front part of the office, and my daughter kept insisting that I would see her. And I was very adamant, and I said, another doctor, they're going to tell me, you know, everything's okay, just go home. I was a little depressed behind it because it disfigures your face. When she saw me, I asked her if she would see me, and immediately she said okay. And that was a little shocking to me, because most times they tell you you have to wait for long periods before they can bring you in to be seen.
But not here with Dr. Udochi.
No, she said yes from day one, and I've been coming. She has given me the medicine that I needed. My face is back to practically normal. She's just an overwhelming person to have. She just does not look at you as a client, a patient, just somebody she's just going to bring in and send you back out the door. She actually takes the time to get to know you. I have called her in the middle of the night. She didn't hesitate to answer the phone. She is a very caring person. And I suggest, if there's anybody that needs a doctor like her, to please look her up.
Well, that's very powerful, and that again dovetails with what Diane, who we just interviewed a few minutes ago before you, Sinead, said about her, and that's what our research has shown as well. She really goes the extra mile to really treat each and every patient like a family member.
Yes, she does.
And before I let you go, Sinead, what could you tell us about your experience with the staff here as well?
The staff is very caring, as well as Dr. Udochi. They make sure you come in. For your appointments, they will call you several times. And some of them have even offered, it hasn't been me, but I've heard other patients, if they could do anything to get you here, if you're having transportation issues. They make sure that They follow her protocol. They will make sure that you're in touch with the next doctor that you need to go to if she has to refer you out before you leave the office. So it's phenomenal. And if there's anyone out there that is looking for a doctor, I would highly recommend Dr. Udochi with Millennium Family Practice Care.
On that note, we'd like to thank you, Sine, and really appreciate you coming down and sharing some of your experiences with us.
Thank you very much for having me.
Welcome, Brad. It's great having you with us.
Hi, nice to meet you, sir.
Nice to meet you as well. I wanted to ask you, Brad, if you can please tell all of us about what brought you to Dr. Udochi and a few of the things that you've had done over that time.
My wife, since we got married, she always been getting on me that I got to get up with my health, and I always push it off, and she says, it's time to do it. We got married, so we came here, and it was the first time. It was a great experience. She's very thorough. I found out I have high blood pressure, I have herniated discs, really bad allergies, so it was a really good thing that I eventually did come.
Yeah, it's very important. You didn't know you had those things.
No, I did not know that.
Like a lot of us out here, we don't know what we have sometimes, and that's why it's so important to come to a primary care practice to find out where we are health-wise.
Yes.
So then you came here, you met Dr. Udochi, you and your wife, you became patients of her and her practice. You found out you had a few of those problems that you just mentioned. So what happened after that?
I'm on a whole slew of medicine for my blood pressure. It's under control now.
Okay.
You know, we were able to lower my body weight and everything. I'm on some new medicine for allergies, which is helping out wonderful this year. I haven't had any problems.
And before we let you go, Brad, for all the folks watching, any final thoughts that you'd like to share?
Dr. Udochi, she's a wonderful doctor. You know, I'm so happy I found her. You know, she's changed a lot in my life. I'm a lot healthier, a lot more active and everything, so I'm very lucky.
Well, on that note, we'd like to thank you as well for joining us and being a guest in our program.
Not a problem. You have a great day, sir.
You too, Brad. We're now back with Dr. Udochi. Dr. Udochi, the patients love you. My goodness, you treat them like family. They can even call you any time of the day or night. They can even, in a couple of the cases, mention to us that they just came that moment because something afflicted them that was very painful or something that they had to have looked at, and you even saw them right away. As busy as you are, you just don't hear about these things when it comes to visiting a doctor anymore. Those days are long gone, and yet you're still providing all that care.
I like to treat my patients as I would like to be treated. So I see my patients as you know, an extension of my family, and I try to provide the best care that I can. One of our, I would say, our policy at Millennium Family Practice is to allow patients who have urgent medical problems to be able to access healthcare that day. So we do offer same-day appointments for certain medical conditions, and we help manage the patients in the office. For instance, a patient who's developed like an asthma attack will be able to come to the office and get treated in the office, have their nebulizer treatment here, whatever they needed to, they would need medically to make them more comfortable and healthier. We would offer that treatment to them in the office.
Well, those are certainly great benefits. Obviously, that sets you and your practice apart from so many others. You've developed such a strong reputation for patient care. You're one of this region's top doctors. We were very happy to be here today to interview you, to learn more about various benefits of going to a primary care doctor and how it can help so many folks. We really appreciate having you on today as our guest.
Thank you very much. I appreciate it.